Vertigo can be a scary and unpleasant condition to deal with. Know about vertigo can help you treat it properly. Vertigo is a symptom, rather than a condition itself. It is a sensation where you, or your surroundings, appear to be moving or spinning around in circles. This happens while you're stationary in one spot. You may also experience dizziness, light-headedness, or feeling as if you are about to faint. Feeling sick. Headache. Loss of balance, difficulty standing or walking. Nausea and/or vomiting. Pressure in the ear. Tinnitus, ringing ears, or hearing loss. These symptoms may range in severity, from barely noticeable to an intensity that makes it difficult to continue your daily routine. Vertigo can develop suddenly and last briefly for a few seconds to several days in severe cases. What causes vertigo? Vertigo is often caused by a problem in the way balance works in the inner ear. In some instances, it can also be triggered by problems in certain parts of the brain. Vertigo can fall into either one of two categories: A. Peripheral vertigo. B. Central vertigo. Peripheral vertigo commonly occurs when there is an interference with the small sensory organs in the inner ear responsible for sensing gravity and sending information about the head's position to the brain. Around 93% of vertigo cases are due to peripheral vertigo. These are most common causes of this condition. 1. Benign Paroxysmal Positional Vertigo (BPPV) occurs when small calcium particles in the ear become dislodged and move into the inner ear canal. This causes the ear to become hypersensitive to changes in head position, which causes you to feel dizzy. BPPV can occur with no specific triggers, but it is commonly associated with old age and is more common in women than men. 2. Meniere's disease is caused by a buildup of fluid in the inner ear. It can lead to vertigo with ringing in the ears, tinnitus, and hearing loss. It is common in people between the ages of 40 and 60 years old. 3. Labyrinthitis and vestibular neuritis are disorders resulting from an inflammation of the inner ear labyrinth and the surrounding nerves, known the vestibular nerves, which are responsible for sending messages to the brain that help control balance. This condition is often due to a viral infection. 4. Central vertigo can occur when there is a disorder in one or more parts of the brain that controls the nervous system. Central vertigo can be the result of a sports-related head injury, brain tumor, viral infection, or a stroke. The symptoms generally last longer and are more intense compared to peripheral vertigo, although hearing isn't typically affected. Below are the different types of vertigo associated with the central nervous system. 5. Acoustic neuroma, or vestibular schwannoma, is a slow-growing non-cancerous tumor that affects the nerves between the inner ear and the brain. Common signs of this condition include gradual hearing loss, tinnitus in the affected ear, loss of balance, facial numbness and vertigo. 6. Migraine-induced vertigo may be more common in people who are susceptible to motion sickness or frequent episodes of vertigo. Due to the intensity of the migraine, you may experience spontaneous vertigo attacks that are often accompanied with nausea and vomiting. 7. Multiple sclerosis is an unpredictable, often disabling disease of the central nervous system. It disrupts the flow of information within the brain, and between the brain and body, which can lead to vertigo. Vertigo can make you unsteady, which may put you at risk of falling. While vertigo is usually not harmful, you may want to identify the root problem and have it treated properly. Do you know there is a natural way to heal your vertigo permanently? In just 15 minutes with easy head balance exercises, you can be vertigo and dizziness free from now. Start it now by click link below. https://vertigo-dizziness.healyourpain247.com